And many people in aged care facilities, elderly people, they do not drink enough water. And it certainly is a contributing factor to the mental illness and the deterioration in brains we're seeing. In Australia, there are 1,700 cases of Alzheimer's being diagnosed every week. Now, that's a bit scary. Did you know that God never meant our brain to deteriorate? And tomorrow, we're going to go to the brain, and tomorrow I'm going to show you how you can get brighter and smarter and wiser with age. Brains should not be deteriorating. Have you read of Alzheimer's or dementia in the Bible? I certainly haven't. And before the flood, you know, people were living till they were 700 and 800 years old. We're getting people today who are showing signs of dementia and Alzheimer's in their 40s and in their 50s, and this should not be. And it's often not just one point, often it's several points, but one is certainly dehydration. So I'll give you a story to illustrate. We had a lady came and did our program a few years ago now. It's probably about 6 years ago now. She was 45 and she brought her mother who had dementia. So we always say if someone has Alzheimer's or dementia, they will need to have a carer with them. Because we're not a hospital, we just teach you how to give your body the conditions for healing. When the mother first arrived, so the mother was probably early 70s, I went into the bedroom and she was just standing there looking out the window. And she looked at me, she didn't seem to even know who I was or acknowledge me. So I talked to the mother, well, I couldn't say much to the mother, but I talked to the daughter and I found out she hadn't drunk any water for 2 days. And because she had dementia, her daughter would ask her and she'd say, oh yes, I've drunk lots of water, but she actually wasn't drinking any. And she hadn't been to the bathroom for 3 days. I'm talking about her bowels. So they're two things that we can fix pretty good. So we gave her herbs to get the bowels moving, and we just got her to drink little bits of water. See, a lot of elderly people are put off water because they don't want to have an accident. But if you can explain to them, just have a mouthful at a time. That's reachable. Just have a mouthful at a time. If you have a mouthful of water every couple of minutes, you'll be surprised how much water you can get into the body in a day. So just have lots of little bits. Within 24 hours, this lady had no dementia. She was lucid, she was talking to people, sitting and dialoguing, and the daughter looked at her and she hadn't seen her mother like this for a long time.
Dementia encompasses a range of brain disorders characterized by memory loss, cognitive decline, and behavioral changes. Alzheimer's disease accounts for 60–80% of dementia cases, followed by vascular dementia, Lewy body dementia, and frontotemporal disorders. The brain's intricate network of neurons relies heavily on a delicate balance of nutrients and hydration. Factors contributing to dementia include chronic dehydration, poor circulation, and inflammation. Chronic dehydration, even in its mild forms, can impair cognitive function, causing confusion, memory lapses, and reduced focus. Over time, chronic dehydration may exacerbate the brain's vulnerability to neurodegeneration. Poor circulation caused by dehydration thickens blood, reducing oxygen and nutrient delivery to the brain, which can impair cognitive processes. Dehydration also contributes to systemic inflammation, a recognized factor in Alzheimer's progression. Barbara O'Neill advocates that these issues are preventable by prioritizing hydration, among other lifestyle choices. The human brain is approximately 75% water, underscoring hydration's critical role in maintaining optimal brain function. Water facilitates neurotransmitter production, detoxification, and electrolyte balance. Neurotransmitters like serotonin and dopamine, which are essential for mood and cognition, are supported by adequate hydration. Water also helps flush out toxins and metabolic waste that accumulate in brain tissue, reducing oxidative stress. Electrolytes, which are vital for nerve signal transmission, are regulated through proper hydration. When the body is dehydrated, these functions become compromised, setting the stage for cognitive decline.
You see, I understand what it's like in an aged care facility, because she had her mother in an aged care facility because it was just so difficult to look after her. She really couldn't leave her. That the nurses are so busy, they don't have the time to make sure everyone drinks enough water. And something else happens. When they get them to drink more water, more of the elderly people are having accidents, and then there's a lot more work for the nurses. I understand that. I understand it. I think it's our role to give our body the conditions so we never get there. Is that right? So that when we're getting into our latter years, our kids will want us to live in the little granny flat because we're going to mind the children. We're going to put the washing on the line. Oh, that's right, you put them in the clothesline. One of the signs that you're drinking adequate water is that your urine is clear. So when your urine is clear, that's a fairly good sign that you're drinking enough water. Now, at the moment here at the retreat, you're having B vitamins, and those B vitamins have an effect on your body to cause your urine to be fluorescent yellow. So don't be surprised if this week your urine is fluorescent yellow. So you just got to find out how to get it in.
Barbara O'Neill emphasizes the simplicity and efficacy of hydration as a preventive measure for dementia. Staying hydrated ensures improved blood flow to the brain, enhanced cognitive function, and reduced inflammation. Dehydration decreases blood volume, limiting oxygen and nutrient delivery. Chronic oxygen deprivation to brain cells may accelerate cognitive decline. Proper hydration has been shown to improve focus, memory, and problem-solving skills. Regular water intake can mitigate age-related cognitive decline. Drinking enough water also reduces inflammation, which has been linked to amyloid plaque formation, a hallmark of Alzheimer's disease. Barbara O'Neill advocates monitoring urine color as a simple yet effective tool to assess hydration levels. Clear to light yellow urine indicates optimal hydration. Dark yellow or amber urine signals mild dehydration. Brown or tea-colored urine indicates severe dehydration and potential kidney stress. She recommends drinking water consistently throughout the day, adjusting intake based on activity level, climate, and individual needs. The general recommendation is to drink at least 8 glasses or 64 ounces of water daily. However, individual requirements vary based on body weight, activity level, and environmental conditions. Larger individuals require more water to maintain hydration. Active lifestyles increase water loss through sweat. Hot or humid climates elevate water needs. Barbara O'Neill suggests starting the day with a glass of water to rehydrate after sleep and incorporating water-rich foods like fruits and vegetables into your diet. If you enjoyed this content, don't forget to click the like button, hit subscribe, and turn on notifications to stay updated with our latest videos. Thanks for watching, and we'll see you in the next one.